Okay, we should be live. Yep.
Well, welcome everyone to the third episode of conversations about COVID-19 plus whatever else may come up through the McGill Office for Science and Society. Let me just give you a touch of a background on who we are, for those of you who are not familiar. We are a university-based organization. McGill is probably Canada's top university. And our challenge here at the office is to demystify science for the public and our students, to separate sense from nonsense and fact from fiction. We'll try to do that for you here this afternoon with some stories that we have, and also we'll answer your questions. But let me introduce you to everyone. Emily Shore is going to be manning the phones, manning the comments. She's our communications director, and she will be forwarding questions that you guys send in. We also have Jonathan Jarry, who's a science communicator in our office. His background is in molecular biology. And there's Ada McVean, who has just graduated in chemistry, which of course is a science that ties all the other sciences together. And you will also meet Dr. Debbie Schwarcz, and you may notice some facial similarity between Debbie and myself, and there may be some genetic reason for that. Anyway, I'm Joe Schwartz. I direct this office, and we were founded about 20 years ago, and we've been hopefully doing the right thing, separating sense from nonsense since that time. Of course, we have never experienced any situation like we have now. This is totally unprecedented, but it does give us quite a bit to talk about. So first of all, we're going to turn to Dr. Debbie, who is an emergency physician, and she works in a hospital here in Montreal. And of course, they are getting ready for what should be the cusp of the curve. So Debbie, what's going on in the hospital? And you can tell us a little bit about this pretty interesting effort of building a tent in the parking lot, which is going to serve as basically an extension of the hospital.
Exactly that. So it's pretty amazing stuff that's happening at our hospital and many hospitals across the city as well. Our volumes have definitely been starting to pick up again this week. I know when I talked to you guys last week and the week before, I was talking about how quiet it was in the emergency rooms. I think that we really scared people off of coming to see us. So people are either starting to not be so scared anymore, or I guess that there's only so long that you can stay away with abdominal pain and chest pain and the like. So definitely our kind of regulars are starting to come back again, and we're definitely seeing more and more cases of
go on the email.
Coronavirus presenting.
I need to watch
a lot of the time is respiratory distress, also as undifferentiated fevers. So we have created a couple of different tents outside. If you pass by our emergency room, you'll see them. It started out as one of them being a screening tent to basically a pre-triage to not allow anybody into the actual hospital until they've been asked a slew of questions to rule out their risk of coronavirus. And now it has extended into a extra resuscitation room that has 2 beds in it, as well as a ward where we are going to be housing people with rule out coronavirus.
So at least so far, you're certainly not seeing the catastrophic conditions that they're experiencing in New York.
No, absolutely not. I mean, granted, my hospital is a smaller community hospital, but I think that from all my colleagues that I've spoken to that work at various emerges around the city, I think that the situation is pretty similar across the board. So I think that what the physical distancing is definitely helping. I don't think it's time to stop. So I think it's important that people don't become complacent about it. But I think that it's obvious that it's working. I think that we have definitely been able to prevent many people from becoming sick. But we are still climbing that curve. And I think that every day we are definitely still seeing more and more cases. But but we feel prepared and we feel like it's manageable at this time. The issue of PPE, the personal protective equipment, is still an issue. I know that Justin Trudeau just said that he had welcomed a shipment in of millions of PPE attire, but I haven't seen it, and there's still very much severe shortages, especially of N95 masks and gowns. So while we are doing well, I think overall there definitely is there's still quite a bit of risk that we're all worried about.
Now, the origin of this virus is something that is being talked about a lot. Many people blog about it, have opinions about it. And Jonathan, all the stories about where this virus may have originated. Originally, it was thought to come from bat poop that was transmitted to animals in China, particularly this one wet butcher shop, as they call them. But there also are contentions that it may have somehow escaped from some laboratory.
Yeah, I mean, this is a story that's been going around for a while, and there's some new developments, I guess, to this particular story. It so happens that China's only biosafety level 4 lab is in Wuhan, and of course the outbreak started in Wuhan. So it looks like 1 + 1 = 2, but it's not that simple. So U.S. intelligence are now investigating the possibility that this virus might have escaped from this lab in Wuhan. But we do have to be very careful, because even the Joint Chief of Staff chairman said the weight of the evidence seems to indicate natural origin. So there are a number of theories that are bundled up in here. The most ridiculous one, perhaps, is that this was a man-made virus for nefarious purposes. Absolutely not. You would expect the backbone from a disease-causing virus to be in there. It's completely missing. We have the full sequence. We also know, this is very interesting, like if you're a mustache-twirling evil scientist, this is my little coronavirus here, the virus comes inside your cells by binding to them the way that a key fits into a lock, and the key is this little spike protein here. And we had a similar coronavirus for SARS in 2002, 2003 that would also bind to the same receptor outside of our cell, ACE2. But this one, when you put the sequence of this thing in a computer, it tells you that it shouldn't bind to ACE2 receptors very well. So if you were, again, this nefarious scientist who's trying to, take over the world, why would you make a spike protein that is predicted to be much worse at infecting humans? It doesn't make sense. Now, it turns out that the virus is actually has found other ways of infecting our cells. It's better than what computers would predict. But all that to say that there's no evidence that this was man-made. Now, was it grown in cells in the lab? It's quite unlikely. We find sugars that are bound to very specific bits of the proteins that are coded by the virus, and those suggest the involvement of an immune system, which you can't get in petri dishes. These are just cells. There's no immune system there. So the last thing that's left is, was this a natural virus that was being studied in a lab and that escaped? Now, I have read that U.S. diplomats visited this level 4 lab in Wuhan in 2018. They apparently complained of substandard safeties in place. Basically, we don't know at this point, and I think the bottom line is that it's plausible. Like, I'm not going to say it's impossible. It's plausible, but it's highly unlikely. That's what we know so far.
Ada, originally we were talking about how this virus may have jumped from animals to people, and now there's also talk that it can jump from people back to animals, and the story of the tigers in New York.
Yeah, it's really interesting. I've been reading a lot from different veterinary organizations. The American Veterinary Organization, AVMA, has actually had a lot of really good info on this. Basically, right now, a lot of people have heard stories of there was a 17-year-old Pomeranian in Hong Kong who seemed like he had become infected and then passed away, possibly from related things. There was a Dutch cat. There was a couple other isolated cats all over the world. And so far, there doesn't seem to be credible evidence that the virus can pass either from cat to cat or from cat back to human, or from domestic animal back to human. But there does seem to be some evidence that in exceptional circumstances, the virus is able to pass from human to animal. Most of these cases, the animals haven't really shown symptoms. And if they have, they've been relatively mild, just upper respiratory symptoms, which are really common for a lot of domestic animals, especially cats. And And in a lot of cases, like with the 17-year-old Pomeranian, 17 is quite old for a Pomeranian. And the dog ended up dying of completely unrelated issues. So it is possible that the animals becoming infected are immunocompromised. With the case of the tigers in the Bronx Zoo, there's a good chance that they were under at least some physiologic stress based on being in a zoo, and thus that can lower your immune system and have their immune response be not as strong. So the other big thing that I've been reading about is a lot of people being concerned that if we're testing animals, we're not testing humans. That essentially they're using the tests that we already don't have enough of for humans on these animals. But the tests that they're using for animals are actually specially designed for animals. Usually they're species specific, but at minimum they're specific for like Felidae and Canidae families. So these are not the same tests that are being used on humans. And so we're not taking away from humans to give to domestic animals. We're two parallel streams of development. So you don't have to be worried that this tiger got the test that was meant for you.
No, and I think we can offer the advice that this is probably not a good time to get a tiger as a pet for your home.
No, very, very much not.
Is it ever a good time, though?
Well,
depends if you're
Tiger
dog-gentle or not. Yeah.
I think there's agreement, of course, that by whatever means this virus did originate in China. And there are a number of interesting treatments that are being tried in China, beside the conventional ones that have been talked about, hydroxychloroquine and various antiviral drugs. There's also the story of traditional Chinese medicine, which is very interesting because in China, medicine is divisible into two categories. You have the really cutting-edge technology. There are Chinese hospitals that are, as good as any in the world. And in the same hospital, sometimes they will also practice traditional Chinese medicine, which involves things like acupuncture, various kind of herbal treatments. So it's a very interesting juxtaposition because in Chinese society, there's a lot of emphasis on these traditional means because, of course, until recently, they didn't have modern medicine. They had to rely on this. And there's been a lot of, under the communist regime, there was a lot of emphasis on trying to go back to these traditional means because they were not able to provide the most up-to-date medical care. And one interesting story that is coming out from China now is that there actually are some of these traditional remedies that are recommended by the government, even though they don't really have any real evidence as we would like to see. And while it's certainly true that some forms of traditional Chinese medicine have benefit, and we know, for example, that the ephedra plant, which has been used for thousands of years, gives us ephedrine, which is an effective drug against asthma. Artemisinin, which is used against malaria, comes from a plant that has traditional use in Chinese medicine. But unfortunately, in this case, there's also a remedy that is actually being recommended by the Chinese government that contains bear bile. And this is a troublesome story because it is actually legal in China to raise bears, this very special type of brown bears, and they extract their bile either with a syringe or by putting a catheter into the gallbladder and draining it, and they make a medicine out of this. There's no evidence for this, that this can do anything, certainly not in the case of COVID-19. And yet this is something that is recommended. There's another product that is being recommended that is supposed to be made from a variety of herbs and plants and goat horn, which of course, I can't think of any reason why goat horn would have any kind of efficacy. But because it is believed that rhinoceros horn has special properties, even though that is illegal in China, some of these underground drug producers are substituting rhinoceros horn for goat horn, neither of which, of course, would have any efficacy in COVID-19. But this is happening, and Ada, I'm sure that you're disturbed by this because I'm sure you've seen some of these stories about how the bears are raised in captivity in China, and it's really a terrible thing.
Yeah, there's a lot of animal cruelty and suffering that goes on kind of in the pursuit of traditional Chinese medicine. I mean, one of the big theories early on, I'm not actually certain what the current status is, but a lot of the early theories were that this virus came from pangolins, and pangolins, not penguins, pangolins are used, their scales are used in traditional Chinese medicine. So it's very possible that if this jumped from pangolins, either through bats or from bats through pangolins to humans, that this virus was, in a way, a result of traditional Chinese medicine.
Right. And of course, besides Chinese medicine, the Chinese proper researchers are also doing studies. They're doing, for example, studies using huge doses of vitamin C intravenously, 20 grams twice a day. Although so far I haven't seen any results. And of course, they're using hydroxychloroquine. Now, Debbie, I know that many hospitals, including yours, are trying hydroxychloroquine just to see if anything happens. Is there anything that you've seen? Any kind of benefit?
So I can't answer that question because we're still considered to be a cold hospital, which means that as soon as we have a patient that's confirmed COVID, we may start them on the hydroxychloroquine, but they get transferred to another hospital.
Okay, and so far, in many hospitals across North America are trying some proper randomized controlled trials. Some just, some doctors just trying it in an offhanded way. And so far, I think there's no consensus that there's any significant benefit. I think if there were any real benefit from this, we would have seen it already, because there's so much anecdotal use of it, and something would have come up. So I think my guess is that maybe used at a very early stage of disease, it might have something, but this is not going to be the game changer as it is being portrayed. Something else that is very interesting that is coming up is whether or not the masks can be reused, disinfecting. And, up to now, there have been there's a lot of blog posts and everything. People have been trying things. But for the first time, we have some real scientific studies that have been done on the N95 masks. And it is, in fact, possible to disinfect them and reuse them. And there are basically 4 techniques that have been tried here. One is vaporized hydrogen peroxide, and that will do it in about 10 minutes. There's shortwave ultraviolet light, and about an hour exposure to that will also disinfect. Alcohol has been tried. That works, except that it also destroys the filtering ability of the mask, so that's not very good. And heat treatment at 70 degrees for about an hour in an oven does so as well, but that also can compromise the filtrating ability of the mask. So I think there are techniques out there that are shown to work. And just one last thing before we get to your questions. The question comes up of how do they do these tests? How do you know whether or not these filtration techniques or the mask maintains its filtration capacity, or whether or not there are viruses on there? And it's very interesting because what they actually do is take the mask, they apply a certain dose of virus to it, and then do the disinfecting technique, whether it's the UV light, hydrogen peroxide, or whatever, and then take a fragment of that mask and put it into a culture dish where you have some cells that could be infected with the virus. And they measure how the virus replicates in those cells to determine just what amount of virus was remaining on the material. So at least they're doing this very scientifically. But hopefully we won't have to worry about this very much, because we should be catching up on the manufacture of these masks. Okay, so Emily, do we have any questions out there that we can try to answer?
I just want to make sure everyone can hear me this week, so let me know if not.
Loud and clear.
Okay, hopefully. There's a few, but one is looking at the opinion on children returning to school within the next month or so, which I know here in Quebec there was some talk about that, and then our premier retracted that. But there's talk that kids will develop a herd immunity, but the scare is then they put their parents and teachers at risk. And what do you think about that? Can you comment on that?
Do that one?
I think that it's probably premature. And I think even Premier Legault kind of jumped the gun on it, and he did take that back a few days later. As much as I would love for schools to reopen and to be able to send my 3 children back to school, as they're like screaming at me upstairs, I don't think that it's feasible. I think that what's important to remember is that we will one day go back to normal, but it's probably going to be a new normal. I do think children will go back to school at some point, but it's probably not going to be open the door and everybody file in like it was before. So, I mean, some ideas that I've had personally about return to school is doing it in like a gradual way, maybe so that not all the children are there on the same days, to decrease the number of kids in the school at the same time. So these kinds of things, I think it's still important to practice the physical distancing, and it will be for many, many months to come. But maybe there's a way to go back to it a little bit earlier rather than later by doing something like that. I'm trying to be optimistic, but I think it's a little bit too optimistic to think that they'll go back on May 4th. And as for herd immunity, I mean, this is definitely an interesting idea. I think it's a real possibility, but yes, there is the concern that so basically children, it's looking like children, despite even if they are infected with coronavirus, that they don't have the same evolution that many older adults have. Although there definitely have been some children who have gotten extremely sick with coronavirus. Don't get me wrong, but the statistics show that usually they are asymptomatic or they have mild viral type upper respiratory tract symptoms. So I think the idea of herd immunity, it's nice, but there definitely is a risk to their parents and to their grandparents. So one of the other potentials is, potentially bringing back children who, keeping children home who have exposure to relatives that are severely immunocompromised. I don't think that there's a clear-cut answer to it. I think until we get a vaccine.
One interesting theory that I've heard is that the children's immune system is actually not that well developed, so that you're less likely to get a cytokine storm in a child than you are in an adult. That is, you're less likely to get an over-immune reaction, which is... Yeah, I've heard that as well. I mean, look, kids are like little petri dishes, right? And they get all kinds of viral infections. It's like they're so used to it. It's like, oh, one more. What's one more? But definitely there have been some young children that have been very sick. So I don't mean to make light of it, because absolutely kids have gotten very sick. I mean, this virus is doing all kinds of weird things. I mean, even like people in their 20s, 30s, 40s with no past medical history are falling sick in the ICU, which is so unusual. Yeah.
So I think we don't know. That's the problem, that there's so much that we don't know. And I think ultimately the answer will lie in a vaccine. And I can't wait to hear what the anti-vaxxers...
We're all hoping for that, and it sort of seems to be a given that a vaccine will be found. And I'm not quite sure that, we can go by this 12 to 18 month target, because after all, there are viral conditions. HIV, for example, we've been looking for a vaccine for 35 years without coming up.
Oh my gosh.
So there's no guarantee that there will be a vaccine.
Well, it's actually what Dr. Fauci says when people ask about the timeline, is that humans can't come up with the timeline. It's the virus that dictates the timeline. And so
there's no guarantee.
Back for a moment to one thing that I mentioned before about the hydrogen peroxide vapor being used to disinfect masks, which is, of course, scientifically very legitimate. However, based upon that, there are also recommendations on the internet that people should be inhaling hydrogen peroxide vapor in order to kill any virus that may be inside. Where does this come from? Well, one of the sources is that ultimate source of wisdom, Dr. Joe Mercola, who is an internet celebrity. He's a trained osteopath in the U.S., and in the U.S., osteopaths are legitimate physicians, although he hasn't practiced for, over 20 years. But he's got a wildly popular website, which is a grab bag of some sense, but mostly nonsense. And he actually recommends inhaling hydrogen peroxide vapor. There is, of course, no evidence whatsoever that can kill any virus that you have in your system. So it's very interesting how sometimes, you can take legitimate bits of science and then blow them completely out of proportion, which is what many of the charlatans will do. Okay, Emily, another question?
Yeah, this was actually a question from last week, but I see it coming up everywhere, really. The connection with vaping, if there seems to be a connection there.
Jonathan, what do you think?
I don't know. I haven't looked into that. I know that. Oh, there you go. Go for it.
Sorry, I was looking into this earlier today. I'm writing a piece for a different organization about vaping right now. So it's something I've been reading about. Essentially, so if assuming you're vaping cannabis, not nicotine products, because the situations are quite different. If you're vaping cannabis products, it essentially comes down to whether or not you bought a reputable vape. Because if you bought a reputable vape, which is licensed and approved, then it doesn't cause combustion of the material. And if it doesn't cause combustion, it only causes vaporization, then the inflammatory response of your lungs is much, much less because you're creating fewer polyaromatic hydrocarbons and other things that tend to cause general inflammation of your lungs. It's not to say there's no inflammation if you're using a registered vape, but there's much less. And the problem is that you don't want these combustion products breathing in because it causes inflammation of your lungs, which can lead to chronic bronchitis, which can generally weaken your lung cells' ability to fight off the coronavirus infection. The situation is very much the same if you're smoking via whatever method cannabis, whether it's a joint or a water pipe or whatever. It's just the inhaling of combustion products. But so the safest way, the article I read this morning was the safest way to get high during a pandemic. If you do want to be using cannabis, especially given the high stress situation that we're all in, by far the best way to do it would be with edibles, because you are avoiding those combustion products, or a vape that is licensed and approved. But you do just want to go easy on your lungs, essentially. So if you can use your drug of choice without disrupting your lungs too much, that's a much better option.
I think edibles are allowed now here.
Smoking, you are exhaling more potential viral particles than otherwise because you're releasing a lot of breath.
That's true. Don't smoke in public.
And there's also
don't smoke. Friendly PSA from your neighborhood family doctor. Just don't smoke.
Just don't smoke. But if you're gonna smoke,
and I would also, I also do want to make a point about edibles because I actually do see quite a lot of ER visits because of edibles, and I would say that it's not that I question. I mean, it's not that so much that I question their safety profile. I'm not saying that they're not safe, but they do lead to a lot of anxiety, a lot of panic, so much so that patients end up in the ER. A lot of GI gastrointestinal symptoms. So it's not something that I would recommend. You can very easily overdose on those without knowing.
One of the problems there is that people take it, and because of the lag time for the effect, they think they have not taken enough, so they take more, and then all of a sudden it hits, and then you get the GI symptoms.
And then you get the 911 call.
And you don't want to end up in a merge right now, that's for sure.
No.
There's also a concern that the smoke itself, which is of course composed of very small particles, that viruses can ride on those small particles. I don't know if anyone has actually looked into that, but that it's not an impossible situation.
Well, this might be totally far-fetched, but I am a gum chewer. And when I have been outside walking on my social distancing walks and chewing gum and blowing bubbles and sometimes then popping them, and then I stop myself thinking that maybe there are particles coming out of my mouth that's also, would be a potential hazard.
Anyway, we're glad to hear that you can actually chew gum and walk at the same time.
Thank you.
Right.
But I do think you're right, Emily, that you are absolutely. I mean, you're spitting.
Right.
It's just when some people when they talk, we all spit a little bit, but some people spit more than others, and I think that the mask wearing in public, that's the reasoning behind it.
Well, that's
also so we don't have to see you chewing your gum.
Right. But that's Trudeau's speaking moistly. Right?
Exactly.
Right, exactly. We have another question that was from last week, but I'm sure it's on everyone's minds because Debbie, you were talking about life getting back to normal, and sports teams is one way that people can kind of do that. So someone asked, sports leagues like the Australian National Rugby League, they're thinking about accelerating the start of their season by isolating teams on an island and then bringing them back to the mainland for games, but with no fans in the stands. I mean, what is that? Can you isolate with 14 people and then be with those 14 people or 28 people?
Well, I don't think this is going to be marketable because those of us who are sports fans, and I mean, we really miss our sports. I must say that
I miss hockey so much.
I'm getting tired of watching,
Old Habs games.
23rd games. Although some of them, of course, are quite good because you forget what happened. So I still do watch them. But I don't think that you're going to capture people's attention by having a game played in empty arenas. And
Joe, we can generate crowds using computer imagery. You've seen this on television. You've seen this in the movies. Yeah. What if they do that live? Fake people, CGI, canned laughs and applause.
I mean, they are doing this in, I believe, Korea with baseball, right?
What, doing what?
With the empty stadiums, they're still playing and televising baseball games.
Really? Actually in Australia, they're playing Australian rules football, which is a very interesting game, and they play this in 100,000 seat stadiums, which are now empty, except for television crew, etc.
They're still playing right now.
They're playing. It just looks so weird to watch this. But I don't think with the NHL or with the NBA you can generate that kind of excitement playing in empty stadiums.
Although I bet you some teams would be grateful to have CGI people in the seats, like Florida Panthers, maybe, right?
Yeah,
like the Florida
Panthers.
I think that one thing we have to consider is that, as Debbie already mentioned, there are going to be a lot of people who kind of get sick of taking all the safety measures. And the point may come, well, we just say, well, hell with it, come what may be, and we're just going to go back to living what we think is a normal thing.
Debbie, maybe then can you comment, we're in the fifth week, really official fifth week, on COVID complacency and how easy it is to slip into that, but the dangers of doing that and how it shouldn't be so.
Yeah. The danger is more surges, more peaks, as we go. And I think at a certain point, we have to relax the rules a little bit, but it has to be done in a very strategic way. And it has to be done very responsibly. So I think that the first measure that was taken, Legault just announced that there are certain other services that are now considered to be essential. And he's put back to work, for example, landscaping companies, gardeners, mechanics. So you can get your winter tires changed now. I think that this is the kind of strategy that we need, slowly, so that we don't end up getting like a sharp peak going up. So for now, we've done a really good job so far of flattening the curve. We're still climbing it. So I really want to emphasize on that, because it's important that we don't become complacent now. It's not the time. This is actually the week and next week when we have to really stay as far away as we can, because this is when we're going to see the effects of what we were doing 2 or 3 weeks ago to see if it was enough. But this is a problem that's going to be here for a long time. This is not something that is just here for a few more weeks. So we have to be really, really patient, but slow with our reintroduction.
I think the world is going to change after this. I mean, we will go back to a certain state of normalcy, but it will not be like before. And of course, at McGill, we discuss this all the time. What's going to happen, whether in September we'll have classes with students in there, or we'll be doing things online. And so far, the online has been working quite well. And we're just setting up for the summer course. We're running a summer course on food. And for all of you McGill students who are watching this, you can register for the World of Chemistry food course. And we will run it online, and exams are online. And we have worked out a way to do that. And we'll see what happens in September, whether we go live or online. But I think the online is going to be with us for some time. I mean, I think we're learning that you can actually do a lot more with it than we thought we could do. I mean, I hope that we do go back to live classes by September, but we are getting ready to see what we can do if that doesn't happen.
I still have one more class left for my master's, so I kind of hope we're back to live classes by then.
Yeah, well, one thing about this whole situation is that whatever is being predicted is not likely to come true. It's things are going to turn out differently from whatever predictions are being made. Okay, any more questions on that have been texted in?
One was on, they didn't mention COVID in the question, but I'm going to assume that they were talking about that. They said when they come home and they wash their clothes, is warm water or hot water preferable? And again, I'm assuming in a COVID world and not just normal laundry.
Actually, heat does kill the virus, but so does the detergent that you use.
Yeah, so I guess it depends if you're using soap or not to wash your clothes.
Well, detergent.
Right, that's the real question.
Any kind of surfactant will destroy the virus readily because this is what we call an enveloped virus that has a fatty layer, and the fat is disrupted by any alkaline material like soaps or detergents. But Debbie, I'm sure you wash your clothes right away when you come home.
Absolutely. Well, no, as a matter of fact, what I do is I put my scrubs in a bag when I come home from work, and I actually leave the bag in the garage. And it kind of just sits there for 2 or 3 days for the virus to inactivate. And then I wash it. I have enough scrubs that I don't need to wash them right away.
What about, again, I've been reading a few pieces just because of running and working out outside with your outdoor shoes and then coming inside the house.
Yeah, I would leave them in the garage.
Leave the shoes outside, yeah.
Yeah.
Well, for Debbie, it's a different situation, though, because you're exposed, of course, to viral matter in the hospital.
Right.
But I think for the average person, I mean, just walking outside, the chance that you're going to step into some spit that has a virus in it and then come home and leave that on your carpet, I don't think that there's a huge risk. But
why not take the chance and just take your shoes off?
Carpet, here's a question that has come up a couple of times this week. Is what about vacuuming? Because suppose you have some on your carpet, and when you vacuum, the exhaust of that can aerosolize. I mean, you can't say impossible about anything here. I don't think this is a situation that we really have to worry about, because it would mean that you'd have to have a significant wire load on your floor. And that might happen if there's someone with active infection in the house. But for most of us who are just, staying at home for precautionary purposes, you don't have to worry about vacuuming. But people will worry about all kinds of, amazing things that people worry about. I had someone ask me, what happens now that flies are going to be coming out?
Mm-hmm.
What happens if the fly lands on the face of someone who has been infected with the virus and then takes off and lands on your face? Can the virus be transmitted like that? You can conjure up a scenario where that might happen, but I think it is extremely, extremely unlikely, purely because of the foot size of that fly. You can't pick up enough virus on the foot of a fly to transmit. Anyway, that's an opinion. Jonathan, what do you think about the fly transmission?
I think it's highly unlikely. As you were mentioning, at some point, it's all about reducing your risk, but there are certain risk factors that are just so small that we really have to focus on the big stuff. And that's, the surfaces that we touch, the people we come into contact with, that's the big stuff that we need to be careful with.
Emily, any other questions there?
Wait, Debbie, did you want to say something?
Somebody asked about what about the gardeners blowing the leaves now?
Yeah.
I guess that's another one of those scenarios where you can conjure up a picture where a gardener is using the blower, blowing the leaves, and sneezes. And if he is infected, that sneeze is going to be blown, right? And if someone is standing around, could inhale it. But again, these are scenarios that are really, really unlikely to take place.
But the unlikely scenarios, I find I'm one of those, because I've worked in your office for many years, that those unlikely scenarios I always kind of persist, and the likelihood is very low. However, with this virus, I don't know. I'm completely the opposite of how I am, because I find that there's no over exaggeration. The unthinkable has happened. So I guess it's unlikely that I'm going to walk and step in a virus or spit, for that matter. But okay, I'll take off my shoes anyway for the added precaution. Or if someone's blowing leaves, I'll probably cross the street.
But anyway, you should be taking off your shoes in your house anyway.
I know.
Totally unrelated to the
That's
COVID-19.
a constant battle between me and my husband. Yeah.
Well, you should be taking them off too.
Yeah. No, I like them on. He likes them off. We have another question about Debbie, I guess maybe you can comment. If there's really stark differences between men and women who are infected with this virus.
I haven't seen that.
I think statistically there is.
Yeah.
I think men are more likely to be infected for some bizarre reason.
Yeah. What I have noticed.
It may be that men, of course, are traditionally more callous about what they touch and what they pick up, and about cleanliness than women.
Or possibly we're seeing lots of the man COVID cold, which is what we're calling it, and men tend to present maybe more often, and so we're picking it up more often. But what I was going to say, what I have noticed is that there is an increased propensity of COVID-19 being positive and being more serious in obesity. So people who are overweight, they're doing very poorly also. And I think that this kind of ties in with the idea of proning patients, which means turning patients onto their stomachs, which has been shown to really help significantly with saturation levels. So people who are presenting with COVID tend to not be dyspneic, meaning they're not short of breath, but they present and their oxygen saturation is really shockingly low. And then you turn them onto their stomachs and it comes up very quickly. And I think that this ties into the obese issue because of the extra mass that's being put on the lungs just by gravity itself.
Mm-hmm.
We have another question that was actually asked us by email as well. I know we talked about face masks, but I don't think we talked about this in particular. So forgive me if you did. But in terms of cleaning the masks to reuse them, what about soaking them and then allowing them to dry in soap or baking soda would help deactivate it?
Absolutely not. That has been shown not to work. That will destroy the fabric of the mask. So do not do that. One thing that can work is to take a dilute solution of bleach, 0.9% solution of bleach, and wipe the mask 3 times with that. That will disinfect it. The issue there would be for someone who has asthma, because inhaling even minute residues of the hypochlorite vapor can be a problem. But if you then put it away for about a day, it will outgas. But definitely do not soak a mask in soap solution, hoping to disinfect and reuse it. But anyway, all these techniques that we talked about, those are really for medical workers. For home use, a lot of people are just happy to use a bandana. So there, the disinfection is not so.
There's an interesting question here. Again, this is all speculation because we don't know. You don't all have the answers for this. But looking at airlines, will they have to do more with air filtration and, cleaning, obviously they're doing, but the air quality and filtration once traveling is allowed again?
Absolutely. And all the airlines are working on that. They're looking at various kind of filtration systems. Yeah. And of course, the public is going to be convinced that they are making a greater effort. Yeah. But they are all working on that. Obviously, the airlines are in terrible trouble with this. There's even, talk of whether or not only in airlines, but in general in air systems, whether or not there's anything that you can add to the air system in order to destroy the virus that may be present in the air. And, they're looking even at things like essential oils. Now, of course, there's a lot of noise on the internet about the use of essential oils, inhaling these. Eucalyptus is one that is being talked about because of this circulating post about supposedly a study done at the University of Havana, where researchers are said to have studied the use of eucalyptus oil, inhaling hot fumes. You put it in hot water, put a towel over your head. This is a traditional remedy for, inhaling hot vapors. But they are claiming that putting eucalyptus oil in there will destroy the virus. First of all, there's never been any such study in the University of Havana. This is totally fabricated. And it comes from, some experiments which show that in a Petri dish, you can use essential oils like eucalyptus to inactivate viruses. But that is a very long leap from any kind of clinical evidence that inhaling any of these fumes is going to do any good. So really, with these essential oils, if you like the smell of the oil, that's fine. A lot of people like the smell of eucalyptus and ginger or whatever they have in these vaporizers, but this is not going to have any effect on the virus.
How about one more, a good one, I think, is all the different strains of the virus. Does that have an impact on the development of a vaccine?
Jonathan.
So what you've read about the fact that there might be two different strains of the virus is not true. The word strain means different things to different people. If we look at what most doctors would think of as a strain, it means that it behaves differently in patients. For geneticists and molecular biologists, it means something completely different. If there's one mutation in the code, it's a new strain. And there are lots of different strains genetic strains of this new coronavirus. And they all pretty much behave the same way. They don't have a lot of mutations, don't have a lot of differences between each other. So as far as we can tell right now, there is one mega strain, if you will. There's just one really strain of the coronavirus. Now, it could mutate at some point in the future, and it could have an impact on these proteins, for example, at the surface. But for now, the virus looks to be fairly genetically stable, so it's not something that we need to worry about for now.
Very good. Well, I think we've covered a lot of ground here today, and we're out of time. And we will meet again next week. We'll let you know exactly what the time frame is. And I'm sure by that time, there'll be a lot more questions and a lot more information will have come out that we can discuss. In the meantime, of course, we're always ready to answer your questions. You can text them to our Facebook page, the McGill Office for Science Society Facebook page. You can text them directly to me, joe.schwartz@mcgill.ca, and I will get them around to the right people or answer them myself. And document your questions or think about questions and send them in over the next week, and we will get around to discussing them. So that's it for now, and I think we had a lot of fun here, gave you some good information, and Emily could go back to walking and chewing gum at the same time.
Exactly.
Aidan can go back to her guinea pigs, right? And Jonathan will keep us up to date on viral mutations and whatever, and Debbie's going to go back to the emergency room and put herself at risk, right, and cause me some worry.
Goodbye, everyone. Thank you.
Everyone,
Bye.
See you next week.
Next week, and until then, I hope all the chemistry in your life comes out just right.
Bye.